Hi, everybody. My name is Dr. Joy Jackson. I'm an internal medicine physician who's been in Polk County now for nearly 30 years, and I'm currently the director of the Florida Department of Health in Polk County. I'm very happy to talk to you all about assessment of health outcomes. And I'm going to chat with you about two different perspectives. One from my perspective as a primary care physician. I'm an internal medicine physician that practiced very busily for about 10 years and then moved to the hospital side and now the public health side. So I've sort of been involved in medicine for a number of years. And I think before we talk about measuring health outcomes, we need to talk a little bit about how the practice of medicine has changed. When I went through medical school and residency and started practice, we were in a paper-based system. And some of you are young enough that you may not even really be fully aware of what that was like, but everybody had a paper chart and encounters were sort of stacked on top of the paper chart, and each encounter was individual. And once every year or two, there would be a comprehensive physical and there would be an updated form that was added. But when I would see a new patient, I would have to go back through sometimes 2, 3, 4, 5, 6 inches of records to sort of see what the past history was, and it took a great deal of time. So let's fast forward over the years, and there have been tremendous advances in healthcare, as you all are well aware, from the institution of electronic health records somewhere between 5 and 10 years ago, integration with us trying to use a common terminology which falls under HIPAA, and having systems that will eventually speak to one another, with having advances in testing and treatment and significant advances over the years in technology that support modern medicine, things like robotics, potential surgeries that occur from afar. There's just been a wealth of change in medical care in the past 10 years, and I think there's no end in sight, and we can only dream about the future. All right, so let's step back about assessing quality of healthcare. Back in the paper system, to really measure quality, it required chart audits and self-reporting. It was very laborious, and you really didn't have good measures. Now, with electronic health records, we can data mine for a lot of data. What's happened at the same time has just been tremendous amount of research in healthcare. So not only have we had advances in healthcare, but we've had advances in medical knowledge and evidence base, and now we're having advances in data and data integration. So from the private physician standpoint, what happens with this? Physicians now get report cards, and you have paid for performance measures where you actually can get extra reimbursement if you meet quality metrics, which are evidence-based metrics. From the public health standpoint, let me talk a little bit about that, which has been my focus for the past 5 years, is population health metrics and what data supports how healthy our populations and environments are. And this is my current passion. As a healthcare provider, I try to make sure that my diabetic patients achieve American Diabetes Association goals of having a hemoglobin A1C of under 7, of achieving blood pressure and lipid values for that individual patient. I want to achieve these goals for their individual health. When it comes to population health, we look at how metrics pertain to a group of people. For example, a project we're working on now is infant mortality. If I were an OB provider, I would want to know if any babies of my patients died. In population health, we look at infant mortality and how does mortality compare across demographics like race, ethnicity, educational levels, maternal age, etc. We look at populations so that we can then drive efforts to improve health within that community. For example, right now we know in Polk County that our infant mortality rate in the Black population is over 2 times greater than infant mortality in the white population. And infant mortality is measured as infant deaths between birth and 365 days of life. So we then take that data and we dig down into what are the causes of infant death in certain populations. And we know in Polk County we have issues where there is co-sleeping, and there's infant deaths that are occurring because of sleep-related issues, which unfortunately can tend to occur when we put our babies in bed with us, and there's smothering incidents, or we don't put them in a proper sleep environment, and again, where they may smother. So we're using this as a way to reinforce that babies should be put in their own bed, on their backs, with nothing else in the crib with them, including the cute bumpers and the blankets and the pillows that get sold at retail. Those are not safe to be put in the bed with the baby. So that's one example of how we use population health data to really drive the health of a community. We also know, I think from the public health standpoint, that health of a community is not just access to providers. And when you look statistically at what impacts population health, access to a provider is only about 25% of the picture. The other factors that really drive outcomes in health are our living environment, where we live, work, worship. It's how safe is our environment, how much social stress is going on. Are we economically advantaged or disadvantaged? Health behaviors of individuals are critically important. Do we smoke cigarettes? Do we drink too much alcohol? Do we use drugs? Do we take care of our own individual health? So these are called social determinants of health, are critically important in overall health outcomes. So I encourage you all to think about these things. As future informaticists or people that are involved in developing systems that help us measure, it's important that you be aware that it's not just the direct delivery of healthcare within our EHR environment, but it's also things that are going on in the community. And I think this reflects a maturity in our society. In the past, we were almost arrogant enough to believe as physicians that we could directly impact that person's health, which we do play a role. But it's a societal need to support communities that really plays the biggest role in health outcomes. So not only do people have access to health care, but do they have access to education? Do they have an environment where they can get jobs to be financially sustainable? Are we encouraging young folks to be able to sustain themselves with their education, their careers, their life choices, so that they're enabled to provide a good background for their children so we don't have adverse childhood incidences? So I think there's, again, a lot of maturity that's occurring as we see as a society what promotes health and good health outcomes. So as a physician, I'm very excited about the future. I think things are occurring now that are amazing. I think the traditional role of a physician sitting in an office where people come to him or her to get healthcare advice is still occurring, and those relationships are important. But I think as we go forward, consumers will drive some of our healthcare decisions. Telehealth, you accessing your own electronic health record, you potentially monitoring your health within your computer system with algorithms that will tell you things that you need to do to promote your own health. I think we're just starting to see those advancements, and then advancements within the healthcare arena. In fact, I was just reading an article about evaluation of folks that have diarrhea, and now we're going to molecular-based studies, but only in high-risk populations. Instead of just relying on cultures, we're going to be relying more on molecular-based, biologic evidence. There's just a tremendous outpouring of advancements in medical knowledge, and as a physician, I think some physicians, we worry about staying current. There literally are thousands of articles that are printed every day around the world, and the ability to digest all of that and apply it to our patient practices is something that needs to be explored. And in computers that can analyze it and help us gear our evaluation and management of patients is also very exciting. So I think I'm encouraged by what I'm seeing. I encourage you to be progressive and open-minded and look at how we support the health of individuals in our populations and how we help our healthcare providers maneuver the advances, I think, are very important. So I appreciate the opportunity to speak to you. Would be happy to receive any questions by email. I applaud you for facing the challenges of the future and for opening the doors for healthcare in the future, and I wish you the best. Thank you very much.